Welcome to Inspire India, and this is the show where we talk about the good Samaritans, those who are leading the way with a beacon of hope. Yes, these are stories of hope and humanity as we report stories of how many lives have been lost in the pandemic. We often forget to talk about the lives that have been saved because of the efforts of ordinary citizens, civil citizen groups, NGOs, foundations that have been built during the pandemic to help out the needy and those around us who are actually left to fend for themselves. So we are going to in fact talk about two such individuals who are leading the way, both from Maharashtra. Let me introduce Azhar Inamdar, who's from Al-khair Foundation, joining us from Mumbai. Azhar is operating from Maharashtra. He is operating, I beg your pardon, from Beed district. And a lot of work is being done on ground in terms of providing medical services to people in this district, particularly to the poor and the marginalized communities. Azhar, shukriya. Thank you for coming to Miranao and joining us on Inspire India. I also have Mitesh Gupta, who is joining me from Mumbai. Mitesh has started an initiative with the help of his brother. It is not a registered foundation or an NGO or anything of that nature. This is just something that Mitesh decided to start with his own family members, getting meals cooked at his home for the poor and the needy. He lost his job last year, and then we will talk about his journey from there on. Mitesh, shukriya aap aaye. Thank you so much for joining us on Inspire India. So सबसे पहले Mitesh आप बताएंगे हमें, you are just 26-year-old and you were telling me you lost your job last year. That did not deter you from thinking about doing this kind of humanitarian work. How did you start? Your initiative is called Sharing is Caring. Tell us more about it, please.
Yes, ma'am. Initially, I was cooking for 70 to 80 people from home only. Okay. From after 2, 3 days, now there was a large number of people who came to us that they want food. So we took the permission from the society, and now the society is helping us, and we are feeding more than 450 to 500 people daily basis in the society. Hello.
Yeah,
Hello.
yes, but to do that, you would need a support system. You would need that
Yes.
kind of facility even for the cooking. How are you managing that? Who is helping you? How many people are involved with you?
Yes, ma'am. For cooking, I only cook. There are people, society member who help me. They cut the vegetables and everything, and they give me. I cook the meal.
You cook. So it's a lot of
Yes,
work,
ma'am.
isn't it? I mean, on a daily basis, you
Yes,
are
ma'am.
saying you have taken it upon yourself to cook that much of food and
Yes,
you are
ma'am.
catering to 500 people. What is your day like? What is
Yes,
a
ma'am.
typical day like for Mitesh Gupta when you're doing this work?
Get up at 6:30 in the morning, fill the water up, and go to market. Come around 8 to 8:30 with the vegetables and groceries, all that stuff which required. Then start cooking. Then everybody come according to their work down, and they help me to make the food.
Okay. So people help you out, but interestingly,
Yes, ma'am.
the idea is here, and what I found interesting in your story is that this is not a registered foundation, it is not an NGO.
Yes,
You
ma'am.
have completely
Yes,
on
ma'am.
your own initiative
Oh,
tried to get
yes,
people
ma'am.
together. We'll talk about that. Let me go across to Azhar ji as well, who's joining us
Okay.
from Mumbai. Uh, in this case, again, it's something interesting that this kind of humanitarian work has been happening for quite some time. From what I understand, Al-khair Foundation has existed. Azhar Inamdar ji, हमें बताइए कि पैंडेमिक के आने के बाद आपका जो डायरेक्शन है आपके ऑर्गेनाइजेशन का, उसको चेंज करना पड़ा आपको. आप पहले भी कर रहे थे सोशल सर्विस, बट अभी जो स्थिति है उसमें किस तरह का आपका योगदान रहा है आपके फाउंडेशन का?
Yeah, exactly. You said correctly that initially when you formed this foundation, so initially we were just distributing the food kits to the needy peoples. But as we saw there is the means medical emergency in this COVID situation. So across our Bid city, we have formed the Mohalla clinic in the different location of our city, in which we are taking only the RS 10 rupees from our society means any patient, and we are providing them the medical assistance, suggestion, and free of medicines, consultation. So yeah, this is we done. So right now we are running the 2 permanent clinic
But
from our bid location. Yeah. Yeah, please go ahead.
Okay, Mohalla clinics, if you can explain to us, how do they operate? Because I was talking to another member from your organization and he was telling me that initially you had as many as 4 makeshift hospitals, which you created because you wanted to cater to the medical needs of people. Explain to us, what was the need for that kind of a makeshift hospital? Were people not going to the regular hospitals?
Yes, that was the situation in pandemic. The people have the fear that they were not going to hospital due to fear. They have fear that whether they will come to positive or like that one. So we took the meeting with the doctor association, medical association in our city, and absolutely all association helped to us. And in different location of our bid city area, we formed the multiple hospital, Mohalla clinic, and we started serving to them. And last year we have checked around the 20,000 people, patients, and we try to remove their fear from their mind. And out of that, now we are permanently running the 2 hospitals in our bid city, and we are just taking the Rs 30 rupee from them and providing the doctor consultation as well as the free of medicine to them. So daily around in 2 hospitals
medicines
we are
are free,
checking.
doctor's fees is only 30 rupees.
Yes, so all the other expenses from our foundation we are managing.
That's interesting. What I was trying to say is that, for the sake of our viewers, this is what proves to be immensely useful, because this is actually closing the gap between those who need medical care but for whom medical care is not accessible for one reason or the other. Azhar Inamdar from Al-Khair Foundation, what they have done is they have created these kind of mohalla clinics, which is closer to the people. They can access it with more ease, with more comfort. And that has really gone a long way, I'm sure, in saving lives as well, because here is a virus, an infection which spreads human to human. You need to isolate. So all of this infrastructure, if it is missing in the interiors of states like Maharashtra, it can prove to be very, very dangerous. So your foundation that way has done extremely good work, commendable job. Thank you for joining us and sharing this. Do stay on. Let me go back once again to Mitesh. Mitesh, yes, Mitesh ji, can you tell me that when you decided to do this, were you inspired by anything because you were young, you could have done many other jobs, but what is it that motivated you to think that, no, I'm going to focus on this humanitarian work instead of doing anything else?
After I lost my job in 2020 in June, okay, so I started my snacks corner in this 2021 in Feb. 5th of Feb 2021. After 2 months, again I had to shut down because of the lockdown. Okay, so I was thinking that there was a hospital nearby only us, government hospital, Indira Gandhi Hospital. So I thought, I saw many people are there. They are really need of food. Okay, so I like to cook, and it is my passion to feed people. I like to serve society whichever way is possible from my side. So I thought to make food for 40-50 people. The first day there was 70 boxes which we have distributed. Okay. Then after that, third or fourth to fifth day, there was a huge number of people coming to us that we need food. So I and my elder brother had talked with the society that देखो लोग बढ़ रहे हैं, तो हम लोग कुछ क्वांटिटी बढ़ाना चाहते हैं, तो हमें सोसाइटी में परमिशन दीजिए कि हम लोग खाना बना के लोगों को बांट सके. So after a day they give us the permission and they help us with the groceries and vegetables, and daily basis they are helping us to making food, and we are serving 450 to 500, minimum 450 to 500 people daily.
Daily. So for that, you're saying that your society, your residential society, your neighbors, your family and friends have helped you. But tell us, who comes to you for food? What is the profile of people? Are these migrant workers, daily wage laborers? What kind of people come for a daily meal? Okay.
Everyone, ma'am, everyone. daily worker, migrant worker, auto drivers, hospital staff, COVID patient, where we distribute the food now, it's just opposite the government hospital. Okay, so everyone, hospital staff, security guard, everyone come
Okay,
to us.
okay.
They have the food. There is no. Yeah.
So there are a lot of people out there who are struggling to get 2 square meals a day. You have
Yes, ma'am.
identified where exactly this is required. You're saying you've deliberately set shop outside a government hospital, knowing that there would be COVID patient relatives out there. And of course, the word of mouth, I'm sure, spreads
Yes,
whenever,
ma'am.
a service of this nature. Because, hotels and restaurants are shut. Do you think that because of that, a lot of people say, you was talking about truck
Yes,
drivers earlier
ma'am.
before the show
Yes,
when I was
ma'am.
talking to you, how
Yes,
they
ma'am. Yes,
found
ma'am.
this useful?
Yes, ma'am. Nowadays, today only they started the
Okay.
shop or restaurant. I think so. But today we have completed 33, and today is the 34th day we
Yes,
are
yes.
serving the food. Okay. Yes, from last 30 days we are giving food only because there is no restaurant open after 11 o'clock. Okay, and we distribute lunch 12:30 to 2 o'clock. Okay, in that time, number of people come and have it. So auto driver plus sweepers, hospital staff, they are not familiar with the application to go online and order the food. Okay, so we thought that कुछ तो उन्हें without online मिल जाए, मतलब online तो सब order नहीं कर सकते. So we thought that, and we are giving the food to them.
All right. Hygiene and health and hygiene is important. We'll
Yes,
talk
ma'am.
to you about that. Azhar
Yes,
Inamdar
ma'am.
ji, one last question to you on the issue of
Yes, ma'am.
how your foundation is open to all religion is what I understand. Because
Yes, yes,
often it
exactly.
becomes important not to have any such distinction. Your foundation may be based on whatever trust
Exactly.
from whatever community, Al-khair Foundation, but you are catering to everyone. What kind of people are getting help from your foundation?
Yes, we are serving to all the. We are not looking to any religion or any caste. So we are the coming to hospital. So our doctor, our medicine staff, all are means helping to them, providing the all level of the treatment, looking to their condition, whether the how means their condition. So accordingly, we are providing the consultation, medicine, and all kind of the support. Our foundation is providing to them. Apart from that, we have also distributed the food kits to migrants, people from the roads, COVID hospitals. My team also distributed that kind of work. Also, we did. Apart from that, we conducted the blood donation camp, and we are means distributing our blood cards to needy people as well. So this is also we done. So our foundation, apart from this, in the
That's
education terms
again
also,
extremely important
we are
that
helping. Yeah, yeah. Apart from this, in education also,
that's
our
important
foundation
that
is
you are
helping
catering
to
to
the
all
poor
religions, all
peoples.
communities.
Yeah,
There
yeah,
is no
yeah.
bar,
Exactly.
right?
No bar
And
for thing.
the poor and the
Who will
needy,
the
of
reach
course,
to
are the
us? We are
first,
definitely trying to help.
priority for sure.
Yeah.
Okay, so Mitesh, final word to you on how you maintain your health and hygiene when, because there's this misconception when you come across a street food corner or something may not be hygienic. Are you taking care that this is also something of a priority for you?
Yes, ma'am. Yes, ma'am. Each and every member of our team wear masks, wear hand gloves. Without that, we cannot serve. We are not serving anyone. Yes, ma'am. We are taking care of ourselves also and others also. No.
जी तो अभी जस्ट वन फाइनल वर्ड कि अभी का स्थिति क्या है जैसे नाउ द सेकेंड वेव इज स्लोली रिसीडिंग द नंबर्स हैव कम डाउन द डेली केसेस हैव कम डाउन Azhar Inamdar, now are you seeing fewer numbers, fewer turnout? Is it visible that Mumbai is slowly getting back on its feet?
Yes, ma'am, exactly. You are saying correctly. So right now the number of the patients are decreasing day by day. So that is a very good indication for us.
Absolutely. Yes. And what about the Beed district? Is there other people out there aware that even though the numbers are reducing, they still need to maintain
So
protocols? Do people follow the health and hygiene guidelines?
Yeah, exactly. Our government and medical staff all are continuously working on that, and definitely uh, in other city the positions is now to slowly open, but our Beed city is right now also in the red zone. So day by day here the patients are that number of much of count is not here, but yes, the Beed city is in the red zone, and here also the day by day the patients means we are getting. So we are not completely free from the situation.
Right.
Yeah. Yeah.
That awareness is very important. Mitesh Gupta, do you see, I meant to ask you the question, the Mumbai question to you actually, on whether you see visibly that people are aware, they're more conscious, they're taking precautions now to ensure that the chain of transmission is broken, and they're following the COVID protocol. Since you're out there on the streets meeting people, do you see that awareness?
Yes, ma'am. I see. Everyone are wearing masks because everyone are uh, afraid of their life. मतलब कुछ हो ना जाए. Everyone are taking care of that because number of people I see they are wearing masks, using sanitizer. Yes, ma'am.
Yes, and like you said, from today onwards, businesses are going to open till 2 o'clock. Some of the non-essential shops are also opening. Some of the restaurants that are catering, that used to be catering all this while to people around hospitals, might be open. But the service that someone like Mitesh Gupta has rendered during this difficult phase, while everything was shut, that is something that we have to salute. Mitesh, thank you so much, and our gratitude to you for helping out the other Mumbaikars who were out there fending for themselves. And Azhar Inamdar ji, to your foundation as well, since across religions, across caste community, without any bar, Al-khair Foundation is helping out the poor and the needy with a very nominal fees, giving them medical care and giving them doctor's attention, something that they may not have been able to afford otherwise. Thank you so much for joining us on Inspire India.
Thanks a lot, ma'am. Thanks a lot.
Thank you so much.
Well, that's it for now. News and updates continue on the other side. Stay with Mirror Now. Visit us on our social media handles and also follow us on mirrornownews.com. Thanks for watching.